They say the only constant in life is change, and as we age, going through the different stages of life, our bodies also undergo major changes that have an impact on our health. In our previous episodes, we've had in-depth discussions about menopause, and we did promise that in the future we'll take a closer look at andropause. So today we've invited Dr. Opperman to shed some light on this topic, as well as some of the treatment options that are available. Welcome, Mark. Thank you so much for joining us.
Michael, it's good to be back.
Excellent. Now tell us, andropause versus menopause. Let's first go there. What is andropause?
Andropause is basically male menopause. So like women where the estrogen level starts declining when they get older, in men, testosterone levels start declining as we get older. The differences between the two are that women have a clear and definitive sign that now I'm postmenopausal, and that's when they stop menstruating.
Yes.
With men, it's unfortunately not that easy. The decline is gradual, and the symptoms are moderate and mild in onset, but can become quite severe as we get older.
Right. So essentially, at what age do we start this andropause process in men?
Testosterone starts declining from your late 20s, early 30s.
So it's quite early.
It's earlier than most men would anticipate.
Yes.
What I have found in my practice is that younger and younger men are presenting. When I started my testosterone supplementation clinic, I thought that my demographic was going to be men between 50 and 65.
Yes.
90% of the patients in my practice is under the age of 45.
Really? And what's caused this earlier onset of andropause?
You know what? There hasn't been definitive studies done about this, but for me, what I perceive is that the amount of estrogens, phytoestrogens, xenoestrogens that we are bombarded with as men has increased. Our food is contaminated, our water is contaminated, our soil is contaminated.
Yes, yes.
So, you know what, gone are the days where you are not subjected to some form of estrogen.
Yes, yes. Now, what is the impact of the estrogen? Does it literally slow down the production of testosterone in the body, or does it block it? How does that interaction cause this andropause?
So when you look at testosterone, you cannot look at testosterone on its own. Testosterone is one of our steroid hormones. Now, the interesting fact is that in men, testosterone converts into estrogen. So there's a ratio between testosterone and estrogen.
Right.
The more estrogens we are confronted with, the more you're going to skew the ratio. For me, and I might be sticking my neck out, what I find the perfect ratio is for me in my practice with men is 7 parts of testosterone to 1 part of estrogen. And when my patients come in, it can be as low as 1 to 1.
Oh, really? So it's a huge difference in what's sort of established as normal.
Yes.
Yes. Now, obviously, there are lifestyle factors that are influencing that. You mentioned our exposure to estrogens and things like that. Is diet, nutrition a big part of that, or is it more environmental factors that are causing it?
I think diet, nutrition, absolutely. Exercise, mobility, activity. We know that testosterone converts into estrogen preferentially in fatty tissue, and especially in abdominal fatty tissue.
Right.
So the more of a sedentary lifestyle you lead and the more overweight you are, the higher levels of testosterone you're going to convert into estrogen.
So if you start then, you know, or you can recognize the onset, or if you as a doctor have identified the onset of andropause, and somebody is more sedentary, before an actual hormone therapy, would it be advisable to say start with exercise, get yourself moving, start losing that weight, and start to just get into a healthier state in general, and then potentially supplement that with a therapy down the line?
You know what, that's an interesting question. You can look at it from both sides. A lot of the guys that present in my clinic are so demotivated. But this is one of the biggest effects of low testosterone is on the brain. So motivation, energy levels, focus, drive decrease. The moment that you start supplementing with testosterone and those things start increasing again, it's easier to get back into gym. It's easier to get exercising again.
So it's almost like the instigator, if you will, of getting people moving and getting them repairing.
Absolutely.
It. Okay. So Dr. Mark, it's something that I'm finding fascinating because menopause is spoken about so often, but andropause is not. And as you mentioned off camera, it's something that people generally just say, oh, it's age. People are getting older, libido falls, they get a bit tired, whatever, gain a little bit of weight, whatever they might be. But you're saying that you're seeing much younger people coming in presenting with symptoms of andropause versus what you have seen in the past. What are some of those symptoms?
Well, you know, it's interesting enough to see that the symptoms of andropause, male menopause, is virtually the same as with women.
Okay.
We have a decrease in libido. For men, that's the easiest and most obvious sign, is when the libido starts decreasing. Mood swings, irritability, problems sleeping, weight gain, fatigue. Now, most of the ladies out there will recognize this if they are going through these symptoms. Men also get hot flushes.
Okay.
You know, so
power surges, they call them.
That's it.
Yeah.
So, you know, it mimics one another.
Okay.
Just men never spoke about it.
Yes.
And it was never recognized as a medical condition.
Okay, okay. Now, menopause is guaranteed. We know that women go through menopause, they stop ovulating, they stop menstruating. Is andropause a guarantee? Is it something that every man will go through at some point in their lives? Or are there, you mentioned some lifestyle factors that certainly bring on early onset, but are there things that you can do in life that would sort of prevent it? Or is it not possible?
You know what? Testosterone levels decrease over time, and that's something that all men will experience, but not all men will experience andropause.
Okay, okay.
So is it something that can be prevented? I find it difficult to answer that question, especially in today's environmental and social pressures that we live under.
Okay, right.
It's very interesting that the younger men that present in my practice presents with lower levels of testosterone than the guys that present at an older age.
Do you think that this could be attributed to the lives we lead, the stress we experience?
Oh, absolutely. You know what, I think when we're in our 40s, you know what, our careers are starting to really take off. But we also have a family life with children, a wife. You still want to be a little bit active on the sports field. So the pressures of life is definitely, I think, a little bit more severe than it was 20, 40 years ago.
Okay.
So, yeah, absolutely. I really think lifestyle stress has a big role to play in it. When I look at your hormone levels, some of the things that we look at are called steroid hormones, and some of them are called stress hormones.
Okay.
Now, stress hormones can mimic a steroid hormones.
Yes, right. Okay.
Where you know what, the one has an impact on the other one.
Yes.
And that's what makes my work so interesting. You cannot look at testosterone in isolation.
You offer a therapy of hormone treatment. How does that work? What is involved in that?
Well, you know what, when my patients come in, we need to go through your clinical history. There's a lot of things that can affect testosterone production.
Okay.
Then, you know, a clinical examination is required. We need to exclude certain things.
Okay.
A full blood workup, and this would include not only testosterone, but things like estrogen, iron levels, vitamin D levels, your PSA levels, prostate-specific antigen, full blood count, etc., etc. And according to that, we work out a protocol that would suit you in your personal capacity.
Okay, okay. So it's not necessarily just a hormone therapy that you're giving, a hormone supplement, and then nothing else changes. You've got to look at a holistic lifestyle sort of audit.
You know what, testosterone has its side effects as well. You know what, one of them is it affects fertility.
Okay.
So if you are in your younger than 45 and still want to have children, you know what, using testosterone can adversely and sometimes irreversibly affect fertility.
Okay.
So fertility plays a role.
Yes.
Your blood pressure will play an integral part in this. Insulin levels,
Yes.
thyroid hormone levels, some of your normal vitamins, vitamin D, iron levels, they all play an integral part in hormone balancing. And this is what I do. I do hormone balancing more than hormone supplementation.
Okay.
I love saying this. The biggest effect of testosterone is on the brain. Higher functions, concentration, mood, the way in which you relate not only to the world but to the people around you and yourself. Depression, it has phenomenal effects on depression, anxiety, mood swings. The most awesome thing is when I bring the spouses into my practice a couple of weeks down the line and I ask them, what has changed in your spouse, your partner? They all say, he's a nicer person to be around. His mood swings have decreased. You know, he's nicer with the children. It's counterintuitive because I think a lot of people think that testosterone causes aggression. This is exactly the opposite. It's when there's imbalance in testosterone and your estrogen levels, that's when we start getting irritable.
Okay. Dr. Mark, where can people get in touch with you if they'd like to explore it further?
Well, we're online at www.the-clinic.com, or they can get hold of me in my rooms in Johannesburg or Pretoria. I'm going to give a Johannesburg number. It's 011 784 1168.
Fantastic. Dr. Mark, thank you so much for joining us in studio. It's been a great chat.
Thank you, Michael.
Wonderful.